Alright, so next I would like to call upon Dr. Sejal Desai with huge round of applause, ladies and gentlemen. Please let's just welcome her. So I would like to introduce her. She is a gynecologist practicing at Santa Cruz, Mumbai. Also, she is the first trained cosmetic vaginal surgeon in the country. She is from Los Angeles, USA, and she is the founder of IAVA. Also, ladies and gentlemen, let me tell you that she has done really great jobs for society, and let's just call her up. Probably you can tell, you can tell about yourself in brief. So, ladies and gentlemen, let's welcome Doctor. Please come up on the stage.
Good evening, everybody.
Good evening.
Being a woman, and especially being a gynecologist, I think I'm very, very proudly privileged to stand here and to be associated with Save the Girl Child. I think various initiatives over the years have been taken for Save the Girl Child, be it the government, be it the Gynaec Society, be it NGOs, be it media, be it entertainment. But what is blood-chilling still is the facts remain. There are very dismal facts about this country, which I'm sure everyone knows, but I thought I must go through a quick run. And that is that normally the natural sex ratio should be 102 males per 100 females. In India, since 1961, we were at 102 males per 100 females. Today, the consensus in 2011 says that we are 109 males per 100 women. They say any country having a ratio of more than 103, the reason is only female feticide. So we are there. What is more surprising? That it is the states in the north and the west of the country where female feticide is much more rampant. Jammu and Kashmir, Punjab and Haryana have a ratio of 128 boys to 100 girls. Maharashtra, Gujarat is 113, 114. We are proud of Mizoram, Pondicherry and Kerala, where it is 102. It is always the urban population where female feticide is much more than the rural population. So we think we people living in the cities do not see it at all, but it's on the contrary. We say that in Asia, from the year 1990, we are at 11% lesser women, which means we are 10 crores lesser women in Asia. In India, we say more than a crore babies have been aborted by female feticide since 1990, which means even today, we are aborting 5 lakh babies every month just for this. What are the reasons attributed for this? Since I'm a doctor, I'm going to talk evidence-based facts. The reason you might find shocking because we are talking about urban India, but it is dowry. They say dowry is still the reason where when the girl child is born, the parents say, no, we do not want it. The boy is considered an asset and the girl a liability. But still in our homes, when we bring up children, and especially we bring up our daughters, what do we teach them? I want you to cook well. I want you to take care of your husband. I want you to take care of your house. We tell them be subservient, be obedient, and be compromising. And these are the virtues we look for in a woman. There are various other reasons also cited for this. When you go to a doctor's clinic, the doctor is held responsible if they even find out vaguely that you have something to do with a female feticide. But the couple that walks in with elan. I have had people in my clinic who come up and say, Doctor, I have 3 girls. This is the 4th one. I have found out from somewhere in the interior that this is a girl. Please abort it. I may be in trouble, but the couple is not. Have you ever heard of a lawyer who's held responsible for representing a murderer or a convict? They are not. Why is the couple not held responsible is always a mystery. They can move out and say, this is what I want. The changing scenario in India is due to various other reasons also. If I ask you today, okay, yes, maybe the female is aborted, but what happens to a female who is not aborted and is brought into the world by the couple? Let me tell you, a lot of times we hear harrowing stories of the girl children being thrown into garbage cans. We hear that when these girls are brought up, they are looking at their brothers who are given the food and education, and they are made to sit at home. They are married off early, then they go into domestic violence. At the end of it, there are incapacitating health disorders. Looking at all of this, we really wonder that what is the plight of the girl child, even if she's not aborted in the womb. The plight is not really worth talking about. Taking care of these health initiatives, in our own way, we have tried to contribute a little bit to the women. I'm the founder of the Indian Academy of Vaginal Aesthetics, and we have gotten some path-breaking technologies for women in this. One of the ones I'd like to specially mention, they say that 50 to 80% of Indian women suffer from leakage of urine, and nobody talks about it. They suffer from looseness in the vagina, from dryness, from organs coming out of the vagina. The medical term of it is prolapse. Till date, the surgeries were very complicated. They were complicated surgeries. In the last 10 years, we say breakthrough advancements, but they were leaving a tape inside the woman's body. Today, we are the first ones in the country to come up with a procedure wherein there is no downtime, there is no pain, there is no anesthesia, there is no nothing. The patient comes, it's a thermal or a heat-associated radiofrequency machine. We just do the procedure for half an hour and that's it. It's like a wand with magic, nearly like the Harry Potter, as my daughter says. Mom, you have the Harry Potter wand. And that's exactly how it is. So we are very happy to bring that to the country amongst the other innovations. As far as the Girl Child Initiative goes, I think we have a long, long way to go. And we all must get together and walk this long, difficult journey together. Really, thank you very much for calling me here today. I'm honored. Thank you.
Please come back on stage. And yes, I will request Dr. Amita Solanki to also come up on stage and do the honors, please. Thank you so much, ma'am.